Greetings, theists and non-theists. I'm the Atheist Paladin. And this will be the reforms I needed to make a true capitalistic healthcare system. The problem that we face right now is that we have to choose either or. Either we choose the capitalistic system or the universal healthcare. And what is provided right now is really neither, and it's much more the same. So what would I propose as real reform and for a capitalistic system? Well, the first thing I would actually prescribe is the Food and Drug Administration, the one that regulates the drugs. The problem is that they put so much regulation and so much requirements into making sure the drugs are safe, is that only basically expensive drugs that will make a massive profit get passed. None of the, the cheapo cures will ever get passed. It has to be something that you'll forced to be, take for the rest of your life, like the, the heart medicines and the erection pills and all that. That's why there's so many of that stuff for blood pressure and cholesterol, something that you're forced to take for every day for the rest of your life. That's why the current, pharmaceutical industry is like that. You're not going to find, the cure for cancer on a pill because, it won't probably make past the FDA because it won't make much of a profit. The second problem with the FDA is not only that the standards are so high, is then when stuff still gets passed, everybody is sue happy. I mean, they sue for this, they sue for that, and it really makes it pointless. At some point there will always be a reaction to something. Now, if someone was negligent in reporting the possible effects or this or that, then it's understandable. But if it just, it's just something out of the blue, something else they couldn't really foresaw, then really, should you sue them for this and that? No, not really. And this, the third problem with the Food and Drug Administration is that really not even penicillin get passed anymore, and you would wait forever for something like penicillin to come out, and it could have saved your life. There's so many lives, I believe, that were lost waiting for drugs that could have helped them, but they were available in Europe. And they were saving lives there, and we're going, no, it doesn't pass our bureaucracy yet. The FDA really needs to be cut down to the bare bones, if not done away with totally. But, I believe there should be at least a bare minimum system to help act as still as a watchdog, but at this point it's just too top-heavy. The next system I would actually believe is actually a general reform of corporations and lobbying. We need lobbying reform. We need that. We absolutely need that, because really it's one thing to tell the senators and lawmakers we need these sort of laws to help protect this, this, and this, but then you turn around and then put $10,000 in their pocket. That gives undue influence. That gives basically a system that is corrupt, and we haven't had true lobbying reform yet. And really, nothing will ever get past Congress until this is actually addressed. Because nothing will ever really happen because there will always be somebody in the back pocket of someone, and they're going to put, some tripe in the bill somewhere, and the bill will either pass or fail because of this tripe. And it's, it's ridiculous. The second one, the third one, reform I would like to make is the one towards corporations in general. They need to be held responsible for the way their corporations act. And that's the worst part about corporations. You get all the benefits of, getting all this wealth, and yet carrying out their responsibility. That shit needs to end. It needs to end outright. I mean, if you're going to be a CEO of this corporation, and it's going bankrupt, or basically people getting screwed over, and you having $1 million salary or bonus a year, you really need to be nailed to the cross and made an example of. Really, if you can't do what your corporation has states that it's for, then there's something really wrong. The fourth reform I would like to make is actually towards health insurance in general. It's one thing to force health insurance companies to pick up somebody who's already sick, but I think the first thing we should do is make it illegal for them to drop anybody that they're sick. That's the whole point of having health insurance, because when you do get sick, you support it. It makes completely no sense to have healthcare insurance and be dropped because you need to have a surgery, or you need to have chemotherapy. That's ridiculous. That's wrong. And as a health insurance company, you cannot handle that, then really you need to either go away to the dodo or just simply find a better means to provide support to this person. There's no ifs, or ands, or buts about it. So, no dropping of people. Another reform I would like to make is that of what really is causing the issue in this healthcare debate right now is actually each state has their own separate ways of doing healthcare, and I think that's really what is killing our country right now, is that there is no national standard. So as a result, some companies will be in this state and some will be in that state, and as a result they have basically state sanctioned monopolies, because some corporations compete here on this and some corporations compete there on that, but there is no real stance of competition. So what we need to do is set up a national, even Steven sort of insurance plan. Something that can be used anywhere across the nation. And then all insurance companies can get on this, all insurance companies can do this. As a result, it will provide real competition. And that's what I think it is really missing in this, is there is no real competition. And in those, the insurance plan, there needs to be absolutely no requirements for having this or that or A, B, and C. None whatsoever. We need to let the consumer have a choice in the matter. If they can't have a choice in the matter, then there's something wrong. If they want to pay for teeth whitening, then let them pay for teeth whitening. If they want to have abortion on their plan, then let them have abortion on their plan and let them pay for it. And that's part of the problem. What the states are doing, they're making insurance plans have to have acupuncture and teeth whitening and abortions and all this other ridiculous shit that adds to the cost of the insurance plan, and rather than just let the consumer decide for themselves, I need this or I don't need this. And that would really lower the cost of the insurance. Number 5 now. The reform I would like to make is that the more uninsured people that there are, the less the insurance companies can actually keep as profit. And these will be redistributed to non-for-profit and charities, and health savings plans, and research for cures and all that. All this will be distributed that way. So that way, is if there are going to be lots of uninsured people, then the companies will be basically pressed, hey, if we want more profits, I guess we have to insure more people. This will provide more insurance to have more widely available insurance. Now, if the forms I didn't already suggest already help that, this will also help this along. But I'm pretty sure all the reforms I just suggested will already free up a lot of the drastic cost of the system.